First test we're going to perform is the valgus test at the wrist. Alternate names for this test are going to be the ulnar collateral stress test and the UCL test. The structures are going to be the UCL of the wrist. A positive finding is pain or laxity or both over lateral wrist compared to the uninjured side. Sitting with elbow flexed to 90 degrees. Sitting upright, not leaning on the testing side, is going to be the patient's position. We're going to stabilize the distal radius and ulna, and we're going to apply our stress over the next to the distal carpal row and over the metacarpals. The movement of the test is going to be applying a valgus stress to test the UCL, and there are no compensations for this test. Next, we're going to be performing reverse Phelan. Alternate names for this test are the wrist extension test. Structures are the median nerve. Positive findings are numbness or tingling along the median nerve pathway. Position of the patient is going to be sitting with elbows and shoulders flexed so palmar aspects of hands are together and wrists are in extension. There's no stabilization or stress on by the clinician. Movement of this test is going to be patient drops the elbows or raises the elbows above the wrists and maintains contact between the palmar aspects of both hands. Position is held for 1 minute or until symptoms occur. Compensations are not lifting the elbows high enough or the palms coming apart. The next test is the Tinel's test. Tinel's test, also known as Hoffman-Tinel sign or the nerve percussion test. Structures tested are the median, radial, and ulnar nerves. Positive is going to be tingling or pain with tapping on the nerve. Position of the patient is seated with elbow flexed to 90, hands slightly off table. We're going to stabilize the supporting hand being tested underneath. And then we're going to apply our stress over the carpal tunnel to test the median nerve, the proximal radial styloid process for the radial nerve, and the tunnel of Guyon to test the ulnar nerve. The movement is applying a percussive movement with your pointer finger and middle finger to tap over the nerve, and there are no compensations for this test. The next test is Murphy's sign. There are no alternate names for this sign or this test. The structures tested are gonna be the lunate. A positive is the middle knuckle more in line with other knuckles. The position of the patient is seated, hand out straight. There's no stabilizing or stress for this test. Movement is none because it's a passive test, and there are no compensations for this test. Next is the extensor tendon avulsion test. Alternate names are the Jersey finger. Structure test of the flexor digitorum longus tendon. The positive for this test is the digit with the long flexor tendon avulsion does not fully flex into the palm. Position of the patient is sitting with elbow flexed to 90 degrees, not leaning on that arm. There are no stabilization or stresses for this test. The patient is going to make a fist, and there are no compensations for this test. Last test is Finkelstein's. There are no alternate names for this test. Its structures tested are the abductor pollicis longus and the extensor pollicis brevis. Positive for this test is going to be pain with movement, position, or pain with ulnar deviation. Position is sitting with elbow flexed to 90 degrees, not leaning on the testing side, and hand in a neutral position. We're going to stabilize the distal forearm. The stress is going to be applied across the metacarpals. Our movement is patient is going to place the thumb within the fist, and then the wrist is moved into ulnar deviation. Compensations for this test are flexion or extension of the wrist. Elbow extends to try to take pressure off of the brachioradialis if it's extended at all. First, we're going to do the valgus stress test. So I'm going to have my patient place her hand up on the table. I'm going to be the palmar side down. I'm grabbing the radius and ulna, and I'm applying a valgus force to test the UCL. Then we're going to test the involved side. Can I take this off? I'm going to apply that valgus force, looking for laxity or pain. Next is reverse Phelan's, also known as the extension test or prayer test. So what I'm gonna have my patient do is put her hands together, and I want you to push down as your elbows, and I'm gonna hold it for 1 minute. 1 minute's done, good job. There are no positive for this test, or there's no symptoms. The patient's not showing symptoms for this test. Next, we're gonna perform Snell signs. I have my patient place her hand up on the table. What I'm going to do is stabilize her hand, and I'm going to apply tap over the carpal tunnel to see if there's any numbness or tingling or pain down the median nerve pathway. Then we're going to do the tunnel of Guyon to see if it's going down the ulnar nerve pathway, and then we're going to turn her up, and then we're going to tap on the radial nerve to see if there's any numbness or pain down or tingling down the radial pathway. We're going to test the other side as well. So again, carpal tunnel for the median nerve, tunnel of Guyon for the ulnar nerve, and then the radial nerve over the radial styloid process. Next, we're going to perform Murphy signs. I have my patient make 2 fists. We're looking at the middle knuckle to see if it is further back or more in line with the rest of the knuckles. Doesn't look like it on either side, so this is going to be a negative. Next is Jersey finger, or the extensor avulsion test, extensor tendon avulsion test. So again, I'm going to have my patient place her hand up or supinated, and we're going to have her make a fist. Good. As you see, there's no fingers going straight, so we're going to try the other side. Lean on that side. Perfect. Make a fist for me. And good. Next, we're going to do the Finkelstein's test. So I'm going to have my patient place her thumb inside her hand, and I'm going to add an ulnar deviation. We're looking for any pain. There's none, so we're going to test the involved side. Finger, thumb inside the hand, make a fist, and then I'm going to add that ulnar deviation. Again, no pain, so it's going to be a negative. Thank you.